Okay, so pathogenesis means mechanism of the disease, and etiology means what causes the disease. What causes the disease? So, but if you take the literal meaning, patho means suffering, logy means to study. So we have two branch, basically general pathology and systemic pathology. General pathology, we talk about the mechanism of disease at the cellular level. Okay, so basically it is full of principles. Basically it is full of principles, and we in the systemic pathology we see what alteration happening in the specific organ. Okay, like for example, systemic pathology for dental students is oral pathology. Understand? So for that you have a separate course, two course, oral pathology 1 and oral pathology 2. So here we will be telling the foundation principles for that course, oral pathology 1 and oral pathology 2. So histopathology means it is a study of tissues. Okay, it is not study of cells, it is study of tissues under the microscope. So the tissue comes from the surgeon, they do a biopsy or any surgical procedure, they remove the tissue. Okay, and it comes to us, and then we process it, and inshallah in the revision they will do in the lab, they will show you again the processing everything. So then they make a glass slide like this, and they do microscopic examination. That was the slide you are seeing in the lab. So they come to a diagnosis. By seeing them, they will come to a diagnosis. Okay, so cytology means it is a microscopic evaluation of the cells. Actually, how we get those cells from the tissue or from the fluid samples. For example, the person is having thyroid swelling here. What we do, we put a needle in that swelling and we take the fluids out, and we put the fluid in the glass slide, and we use some special stains and to stain the cells like this. Understand? So inshallah that you will be seeing in detail in the mid semester 2. Okay, we have 2 weeks for this. You will be doing it, you will be taking your oral smear, and you will be performing the stain that carries 4 marks. Okay, so that is called cytology or cytopathology. So what are the methods? FNAC means fine needle aspiration cytology. So this is called fine needle aspiration cytology, and the stain used is routine Romansky stains and pap stains. Okay, pap stain is commonly used for cancer screening. Now coming to the hematopathology. Hematopathology is a study of diseases related to the blood cells. And what are the blood cells? Red blood cells, WBCs and platelets. So we make a smear, we take a blood and we make a smear, and here we stain, and we see the different types of blood cells, RBCs, WBCs and platelets. By seeing them we come to a conclusion, that is about hematopathology. So the complete blood count. Okay, we use a stain, Leishman stain. Here we use a stain, Leishman stain, and the complete blood count we do to identify anemia and leukocytosis. Leukocytosis means what? Increase in WBCs. So erythrocyte sedimentation rate, if it is increased, then there is a infection or inflammation. So prothrombin time or activated thromboid time and all we do for identifying the bleeding disorder, whether the patient is having any bleeding disorder. So these are the tests we do in the hematopathology. Some of the tests I mentioned here. So now coming to the clinical pathology, this is very commonly used lab in the clinical scenario. And what we do is we take a blood fluid or urine or any fluids from the body. Okay, we put it in this machine and we get this all the values. Okay, blood, okay, biochemical values like blood count and urine analysis and fecal test and culture and infectious disease testing. So all these things are done in the clinical pathology laboratory. And for example, if we give you a case scenario like for example 23 years old male having fever, okay, or cough or sputum, and uh, he took the doctor advice to go for blood investigation. What laboratory you will send the sample? Okay, you should know which laboratory to send what sample. Okay, so in this case you have to send for the clinical pathology laboratory. If it is only blood, you should give it for the hematopathology laboratory. If it is a tissue, you should send it for which lab? Histopathology. If it is a swelling and you want to do FNAC, which laboratory will send? Cytopathology. Okay. So now coming to the investigation techniques. Okay, in histopathology, we use the stained tissue slide. The stain used is hematoxylin and eosin. In cytopathology, the patient comes to us, we put a needle and we take the fluid out, and that is called fine needle aspiration cytology. And we use a stain, Romansky stain. For cancer screening, you will be using PAP stain. You will be using PAP stain. Hematoclinical pathology, the blood smears are made. See, remember, if we gave a choice, for example, the person is having fever. Okay, you want to test whether he has malaria or not. You all know malaria. Okay, if we want to test whether the patient is having malaria or not. Malaria is a parasite, it is in the blood. So what we do a blood test. So when we give a case scenario like that, when we ask you which lab you send, in that choice, if there is no histopathology, if there is clinical pathology, you have to choose clinical pathology. Understand? Because blood investigation can be done in hematopathology as well as in clinical pathology. Clinical pathology lab all has hematopathology facility. All will have hematopathology facility. If you go to hospital, if you go to the lab, in the clinic, they call it as a CP lab, clinical pathology lab. In the clinical pathology lab, they have all the facility except histopathology. Except histopathology and cytopathology. Understand? For tissue and the cells, they will send to a separate lab, histopathology and cytopathology lab. Rest of all the fluid, blood or urine or feces or any fluid from the body, they want to do whether the person, for example, they took the sputum. They want to check whether the person is having tuberculosis or not. So which lab you send? Clinical pathology. That contains all the laboratory under the clinical pathology, even microbiology. Even microbiology lab is there in the clinical pathology. Understand? So when we give which blood, for example, you want to take the blood and you want to send to the lab, which lab means you can write blindly clinical pathology lab. Okay. So when you send to the clinical pathology lab, they will organize. They will send the tissues where they want, they will send. But if it is a tissue or if it is a swelling in the neck or in the gum or anywhere you want to send, then you have to send to the histopathology or and cytopathology lab. Okay. So don't get confused. Now coming to the autopsy. Autopsy means what? Somebody died. We want to know the cause of the death. If you want to determine the cause of the death, so that is the procedure is called autopsy. The procedure is called autopsy. Otherwise called as, correct way of calling is post-mortem examination. Post-mortem means dead. After dead, we will examine his whole body. We will open his body. We will examine all the organs. We take section from all the organs. We evaluate his whole body and we will find what is the reason of the death. In case of any doubt in his death, that is called medico-legal autopsy. For example, when the person is in a workplace, he died. So somebody is having doubt on his death. So then they will be taking to the court and they get a permission and they will do a autopsy called medico-legal autopsy, otherwise called as forensic autopsy. And when the person died in the hospital, for example, the person died in the hospital, doctors want to know what made him to die, because maybe the doctors may not expecting him to die. Okay, because they were giving treatment, they want to know what went wrong. Understand? So that type of autopsy is called clinical or pathological autopsy. Understand? Usually this happens in the hospital scenario. This happens usually in the any crime areas, and in the crime place, or like in the workplace. Suddenly the person died and they have doubt on his death, so then they will do the autopsy to identify whether it is a natural death or it is a suicide or homicide, like that. That is called medico-legal autopsy. Okay, now coming to the academic autopsy, or they call it as a anatomical autopsy. That is, you guys saw I think you must have seen the cadaver in the anatomy lab, right? So that is the one they call it as a autopsy, but actually that is called cadaver. Okay, so this is the one they say three types of autopsies. The most important one is you should know about medical legal autopsy and clinical or pathological autopsy.